Hi, this is Dr. Bharadwaz. I am CEO and homeopathy doctor at Fidicus Homeopathy. Today we will discuss on one of the common neurological disorder. This is a rare disorder, but it is common in rare diseases. So that is Duchenne Muscular Dystrophy. It is common among the all the dystrophies. So the problem with this disease is people think that when their loved ones or their kids suffering from Duchenne muscular dystrophy, they think that and they conclude that there is no treatment for this disease. Yes, there is no treatment for this disease from the perspective of conventional treatment. What I mean by conventional treatment is allopathy doctor or the treatment you take from a neurologist or a corporate hospital or the doctor nearby you, or it is known as Western medicine or English medicine. This doesn't have any treatment. Even though they treat it symptomatically with steroids and other painkillers. It have lot of side effects. But coming to homeopathy, homeopathy has the best treatment for Duchenne muscular dystrophy. I'm not saying that homeopathy will completely cure. Maybe sometimes it may cure, but most of the times what homeopathy does is it will increase the lifespan of the patient, or else it will decrease the discomfort of the patient. It will increase the quality of life of the patients. When you take the homeopathic treatment, what happens is intensity of the symptoms is decreased, duration of the symptoms is decreased, and also frequency of the symptoms will be decreased. In the same way, the number of symptoms will also slowly decrease. But over a period of time, the quality of the life of the patient and the quantity of the life of the patient both can be increased with homeopathic treatment. What homeopathy does is it will reduce the dependency of the patient on the parents or the caretakers. In the same way, it will increase the lifespan of the patient. Both are possible. It also reduces the pain and discomfort for the patient. So that's the reason you have to consider using homeopathy treatment for Duchenne muscular dystrophy. And coming to the statistics, see, out of 3,500 births of the male babies, one baby or one boy is going to get this disease. And also, females acts as a carrier, mother acts as a carrier. Mother will never suffer from this disease, or the girl child will never suffer from a disease, but they can be the carrier of the disease who gives the diseases to their sons. And if the mother is carrying this gene, it is 50% of her sons will get this disease. And also two-thirds of it is genetic, it comes from the mother, and one-third of it, so out of every three patients, two patients is because of mother has the gene. One patient may have new mutation, even though mother doesn't have the carrier gene, this patients will develop new mutation. So that is the ratio in the perspective. Then you have to understand what is Duchenne muscular dystrophy. Duchenne muscular dystrophy is a genetic disorder. It is the defective genes. It causes muscle weakness and muscle cell death. So every muscle is made up of several cells. It will cause death to the cell and make the muscles weak. Over a period of time, patient dies. So the symptoms will start at the age of 4. You can see the baby is not able to withhold the head or muscles are weak. And by the age of 12, he becomes unambulatory. Unambulatory means he will not be able to walk and he is confined to the chair or a wheelchair. But he is going to die at the age of 27 to 31 years. This is the lifespan. Maximum lifespan of this patient is 27 to 31 years. So one in every 2,600 births or 6,000 births, males will have this problem. So only male child. It is very rare that a girl is going to get this disease. And coming to the signs and symptoms, the symptoms start at the age of 4 and they will continue till death. First symptom they notice is milestones. There may be difficulty in walking or delay in walking, or difficulty or delay in holding the head, or baby is not able to crawl properly. Even though the stage is completed and baby starts walking, you can see that he is falling onto the ground constantly when he is walking or when he is running or when he is doing something. And also he will have difficulty and it will not be so easy as the normal kids. So he will have difficulty in running, he is not able to run properly. If he tries to jump, he is not able to jump. And also if you want to climb anything, a stool or a chair or the wall or a tree, he is not able to climb it properly. Next important symptom is Grover sign. In Grover sign, what happens is the baby try to crawl on his own body when he is asked to stand up. That we can see in the video. Yeah, we will see Grover sign here. Grover sign means the baby tries to stand up by crawling on his own body. So he will stand and he will put the hands on his legs first and thighs first and the body first, and he tries to get up. See, he is crawling on his own body because of the muscle weakness. This is known as Grover sign. Next one is waddling gait. The baby is not able to walk properly. The gait is not proper. The legs will widen while walking. That is waddling gait. And there will be lot of muscle weakness. He is not able to hold something. He will not have a proper grip. He is not strong enough, and the muscles become weak. Next symptom you can see is calf pseudohypertrophy. Calf pseudohypertrophy is we have calf muscles, right? Even though the strength of the calf muscle is gone, the calf muscle appears to be big and large, and it appears to be strong. That is known as pseudo false hypertrophy. Patient tend to walk on the toe. He is not able to walk on normally because all the muscles are weak, especially the anterior compartment of the leg are weak. That's the reason he is not able to walk properly, and he tries to walk on his toes. You can see in this video, the baby is not walking properly. His foot is not completely touching the ground. He is walking on the toes. This is known as toe walking. This is because of the weakness of the muscles of the lower limbs. One more thing you can notice here on his calf muscle, there is abnormal enlargement of the calf muscles. Even though the calf muscles are weak, they become enlarged because of the accumulation of fat and also accumulation of dead tissue in the muscle of the calf. And he will have a lot of fatigue. Fatigue means weakness. Even though he walks for a very small period, or he does any work, physical work, for a small point of time, so he becomes very weak and he is not able to do it. Loss of ambulation. Loss of ambulation means he is not able to stand, or he is not able to walk. He is confined to a chair, or he is confined to a wheelchair by the age of 12. There can be lot of contractures because the muscles are weak. They become stiff as they are not used. They become stiff, and these are known as contractures. All the joints also become stiff, and he is not able to move the joints. There may be a lot of spinal deformities. Spinal deformities means spine, the spinal cord, or the vertebral column which is there, it becomes curved, and lot of weakness around the muscles of the vertebral column. It becomes abnormally curved. And the final stage, you know that heart is a muscle, and also diaphragm is a muscle. Diaphragm is used for respiration. It is very important muscle for respiration. And also myocardium, the muscle of the heart, is also dies, and the diaphragm also dies. As the heart muscle dies, he suffer from cardiac failure and the patient dies. As the respiratory failure is there because of death of diaphragm, respiratory failure and heart failure are at the end of the life of the patient. Then coming to the test, what are all the tests that needs to be done for Duchenne muscular dystrophy? First one is muscle biopsy. What happens in this is, you take the small portion of affected muscle and you put under the microscope and see it. When you see it, there are several changes, like the muscle cells are replaced with fat, and also the muscle cells are replaced with scar tissue, that you can clearly observe in muscle biopsy. And also you can see that creatine kinase levels in the blood are increased because of the muscle damage. See, this creatine kinase which is present inside the muscle cell, which comes out, and it enters into the blood. By this elevated levels, you can see that this is Duchenne muscular dystrophy. And also liver enzymes, all the liver enzymes, when you do LFT, liver function test, all the liver enzymes you can see elevated. And the next one is genetic testing. Genetic testing, you can clearly see that on X chromosome there is a defective gene that is responsible for Duchenne muscular dystrophy. And next one is electromyography. Electromyography is the test conducted to check the electrical impulses in the muscle. Even with electromyography, you can see the changes. Next one is MRI, magnetic resonance imaging. When you see the muscles with MRI, you can see lot of changes, that lot of fat is accumulated and a lot of scar tissue is accumulated in the muscles. Next one is when there is heart failure, when the patient becomes breathlessness and you suspect when there is a heart failure, you have to do ECG, electrocardiogram, and also echocardiogram. Echocardiogram and electrocardiogram are two tests that is determined to assess the heart failure. And in the next stage, what happens is there will be a lot of respiratory problems. As the diaphragm becomes weak and non-functional, you have to perform lung function test. So these are the common investigations you do for Duchenne muscular dystrophy based on the stage of the disease. In order to understand this disease properly, you have to go through the structure and function of a muscle cell, and also the organelle within the muscle cell, especially the dystrophin protein, myofibril, exoskeleton, plasma or sarcoplasm. You have to know about plasma membrane or sarcoplasm. You have to know about muscle cell and also extracellular matrix. And also important structure is cytoskeleton. You have to know about cytoskeleton as well. We will see all these structures in a figure, and we will check what are these and why these are important in muscle contraction and muscle relaxation. Yeah, this is the diagram you have to understand. This is the diagram of the muscle cell. Every muscle is made up of lot of cells. Those cells are known as muscle cells or myocytes. So you can see what I have rounded is a myocyte. Okay, This is a myocyte. This is a muscle cell exactly. It has different structures. You can see this is the outer protective layer. This is known as plasma layer. So this protects the muscle cell. Within the muscle cell, you have different organelles. So, and also you can see this is the orange one, all this orange one. This is the cytoskeleton. Cytoskeleton means these are the proteinaceous structures within the muscle. How these help is, for example, when the muscle is contracted, it will lose its shape, right? And when the muscle is relaxed, it will go back to its normal shape. When it relaxes and it contracts, so the shape of the muscle should be maintained. That shape of the muscle is maintained by this cytoskeleton inside the muscle cell. And also you can see this yellow structure. This is outside the muscle cell. So up to here we have muscle cell. This is outside the muscle cell. Outside the muscle cell is known as extracellular matrix. Extracellular matrix is also a proteinous structure which helps to maintain the structure of the muscle. So muscle is an organ that rapidly changes. It will contract and it becomes short, and when it is relaxed it will become long. So in order to maintain the integrity, in order to maintain that muscle is not damaged or muscle cell is not damaged, this structure, extracellular matrix and cytoskeleton, are very important. This exoskeleton and this extracellular matrix has to be connected to give more stability to the muscle. It's where the dystrophin protein comes. You can see this dystrophin protein, which is in violet in color. What it is doing, it is exactly connecting the cytoskeleton and also the extracellular matrix. See, it is connecting the cytoskeleton with the extracellular matrix. When this is connected like this, what exactly happens is the muscle becomes more defined, and when there is muscle contraction or muscle relaxation, the muscle will not lose its structure. So if there is no dystrophin protein, what happens is because of contraction and expansion, so this plasma protein breaks here. So this completely breaks. When it breaks, what happens is things can easily come out into the muscle cell from outside, and the important things that are to be in the muscle cell will easily go out. So that is a major problem we see if there is any problem in this dystrophin protein. Now we will try to understand what are the causes and risk factor for Duchenne muscular dystrophy. It is known as X-linked inheritance. X-linked inheritance means this disease occurs only in males, not in females. It occurs in boys, not in girls. So we will check deeply why this happens with the help of a diagram. Try to understand this. This is male and this is female. You can see that male has one X chromosome and one Y chromosome. In the same way, female has one X chromosome and the next chromosome is also X chromosome. Females have two X chromosomes, whereas males have one X chromosome and one Y chromosome. For example, if there is a gene that is located on X chromosome here, when the gene is defective, I'm marking the gene in red. You can see that there is no complementary chromosome for it or complementary structure for it. We call this allelic pair. Every genes in the human body occurs in a pair. It will have two copies, one copy from the mother and one copy from the father. So as there is no X chromosome from father, so there is only one X chromosome that is coming from the mother, and this gene is defective and it produces defective dystrophin protein. There is no alternative copy or there is no backup from the father. But in the case of females, what happens? So if there is one defective gene, this is a defective gene from the mother which is on X chromosome, and this is not able to produce proper dystrophin protein, but there is backup. This is from father. Father will give one normal gene. Because of this normal gene, the female baby can synthesis defectless dystrophin protein. That's the reason females act as a carrier. They will not have defect because they will have a backup chromosome or the backup gene in the chromosome. In the same way, the boys will not have it. That's the reason if the gene is defective, even though it is recessive, they will express it in the form of symptom. This is known as X-linked inheritance. This inheritance is coming from X chromosome. That's the reason this is known as X-linked inheritance. This is the reason for Duchenne muscular dystrophy, and it is two-thirds genetic. What I mean by this is, if mother is a carrier of the disease, two-thirds of the patients are genetic background. What I mean by this is, out of every three patients who is suffering from Duchenne muscular dystrophy, two got the disease from the mother. Okay, it is inherited from the mother. But one out of three is a new mutation. Mother doesn't have any problem, mother is not a carrier, but still the male baby can have it because it is a new mutation. The gene got mutated and it is producing the defective dystrophin protein. So it is out of three patients, two patients will have genetic background and one patient will have new mutation. So females are the carriers, so they will not have any defect, or they will not have any defect in the body. They are carriers. Because of this carrier nature, what happens is the boys born to this mother, 50% of the boys will have this Duchenne muscular dystrophy. Boys will not be acting as the carriers because of the defect they are not able to reproduce, and boys will not send this chromosome to the next generation. Coming to the body changes, or what happens in the bodies of the patients of Duchenne muscular dystrophy, it is also known as pathology. We will deeply look into it, what exactly happens here. This is due to defective dystrophin protein. Okay, we will see what is defective dystrophin protein, and what happens when there is a crack in the plasma membrane of the muscle cell. So what happens to the calcium, what happens to the creatinine kinase? Calcium is present outside of the cell, and creatinine kinase is present inside of the cell. So how the muscle cell is died, and also initially the muscle cell will completely recover, that is known as regeneration. Over a period of time it will lose that function, and the repair happens. When repair happens, the muscle cell is replaced with fat tissue and also scar tissue. Because of this, there will be lot of weakness. We will all look into it deeply. Finally, what happens is there will be a heart failure, because heart is also a muscle. And respiratory failure, your respiration also fails, because diaphragm is a main muscle which is involved in respiration. When this diaphragm get damaged, so there will be respiration and heart failure at the end of the life. In this diagram you can see that this is the extracellular matrix, this green one. It is a mesh like structure. This is the extracellular matrix. The blue one here is cytoskeleton. Cytoskeleton and extracellular matrix will give stability to the muscle cell, keep it in its shape. So this is the dystrophin protein. You can see this is a rod like structure. This is a dystrophin protein. This dystrophin protein is attaching internal structure, that is cytoskeleton, with exoskeleton or extracellular matrix, so that entire cell will be protected. It will be strong. When the muscle contracts or when the muscle relaxes, what happens is there will not be any damage to the muscular membrane. This is a muscle membrane that is separating the muscle from the other muscles. You can see that. Okay, in this case, see that this dystrophin protein is not complete, it is damaged. The connection between extracellular matrix and cytoskeleton is lost. These are not attached with this dystrophin protein, because in this the dystrophin protein is defective. When the dystrophin protein is defective, what happens is there will be crack in the plasma membrane. This is the cell inside the cell, this is outside the cell. When there is a crack in the plasma membrane, what happens is the things that are to be there in the within the cell will easily go out, and the things which are outside the cell will easily come out, and this will damage the muscle. We will look what are these in the next video. Important thing that is going to happen is, you can see that these are the calcium ions. These calcium ions, because there is a discontinuation in the plasma membrane, they will easily come into the cell. Once they come into the cell, they will activate the proteases. The green ones are proteases. Normally they have to destroy the protein within the cells that are damaged protein. Any protein is damaged, this is the damaged protein, it has to remove them. So when they are in excessive state, when they are excessive because they have freely migrated into the cell, they will go and attack the normal plasma protein as well. This is the normal plasma protein. As these are excessive proteolytic enzymes, they will attack the normal protein of the cell as well. That's the reason the protein within the cell, or the protein within the muscle, will be destroyed because of the Duchenne muscular dystrophy. You can see this in the video. So the normal proteins are also get destroyed. The next thing that is going to happen is, see, these are the orange structures. This is known as creatine kinase. Creatine kinase is present within the cell. Creatine kinase is the energy for the cell or muscle cell. Because of this, muscle cell contracts. They should present within the cell. They go out easily from this crack. Because of this, what happens is the cell will be there, but there will not be any energy for the cell to contract. That's the reason muscle contraction is lost and muscle becomes weak. This creatine kinase first enter out of the muscle cell, and then it goes into the blood. You can detect this creatine kinase in the blood, and you can confirm the diagnosis of Duchenne muscular dystrophy when there is elevated levels of this creatine kinase. Creatine kinase is very important for muscle contraction because it gives energy. It is an energy source. When there is no sufficient amount of creatine kinase, the muscle is not able to contract and becomes weak. Next thing that is going to happen is, you can see these are lot of muscle cells. Every structure or every cylindrical structure in this is a muscle cell. Initially what happens is, if this muscle cell is destroyed, it will completely regenerated, new muscle cell is formed. So you can see that here, see new muscle cell is generating here. But over a period of time, what happens is, when the muscle cell is gone, okay, and there is no sufficient time for them to regenerate it, that's the reason every muscle cell is replaced with a fat cell. This yellow one is a fat cell, or it is a scar, it forms a scar. That's the reason over a period of time, when the baby grows, the strength of the muscle is completely gone and the baby dies. Initially there is regeneration. Regeneration means the muscle cell is completely formed after destruction, but later stages there is repair, there is no regeneration. Repair means it is replaced with the fat tissue or scar tissue, and the muscle loses its power. This what happens to the entire muscle or muscle cell in Duchenne muscular dystrophy. What is the conventional treatment, or the allopathic treatment, or western medicine treatment, or the treatment you go and take with a neurologist or a corporate hospital? That is known as conventional treatment. Conventional treatments normally uses steroids, or they go with surgery. You all know that surgery will not be much useful, and also steroids will have lot of side effects with it. And the new way is gene therapy, but this gene therapy is not yet approved and not scientifically proved. It is not yet for the public, it is still in research stage. So finally, with this treatment, there is no effective treatment, and there is no effective results from that treatment, and it is full of side effects. That's the reason conventional treatment should not be the choice for Duchenne muscular dystrophy. And now we will check how homeopathy helps you. With homeopathic treatment, quality of the life can be increased, and also the quantity of lives can be increased for a particular patient in Duchenne muscular dystrophy. So how homeopathy helps is, homeopathy is effective in Duchenne muscular dystrophy as in any other rare disease, because homeopathy medicines does not work on the basis of the name of the disease. Homeopathy medicines work on the symptomatology. If any disease, whether it is a simple disease or a rare disease, whether it is a common disease or a complex disease, if a disease has symptoms, homeopathy has answer in it. What I mean by that is, so homeopathic medicines works on the basis of the symptoms, not on the disease name. That's the reason, based on the symptoms we give the medicine. For example, there are 10 different patients who are suffering from Duchenne muscular dystrophy. 10 different patients will have 10 different types of symptoms. In the same way, 10 different patients are given 10 different medicines in homeopathy. That is known as individualization of homeopathy. When you individualize the patient and give the medicine, you have the highest chance of success for homeopathy. And also you have to remember that homeopathy medicines doesn't have side effects, because the medicinal quantity or active ingredient in homeopathic medicine is very low. That's the reason it will not have side effects. Rarely it can produce side effects. Maybe in my experience I have seen, out of 1000 cases or 500 cases, you will have one side effect. Even the side effect is very small. When you withdraw the medicine or change the medicine, that side effect is gone. Finally, intensity of the symptoms can be decreased, frequency of the symptoms can be decreased, duration of the symptoms can be decreased, and the number of symptoms can be decreased. Finally, the quality of life is improved and lifespan is also increased without a single side effect with homeopathic treatment. Then coming to the precautions, what are the important precautions you have to take along with homeopathy? We advise to take physiotherapy. Physiotherapy is very useful when there is a constriction of the muscles, or when there is a restricted joint movement. Physiotherapy will definitely help you along with the homeopathic treatment. And what happens when you neglect Duchenne muscular dystrophy? You are not taking homeopathic treatment. Within 4 years time, the patient will start the symptoms, the kid will start the symptoms. Within 12 years, what happens is, he will be confined to the chair or a wheelchair. He is not able to move. He dies at the age of 20 to 30 years because of heart failure and respiratory failure. So homeopathy treatment is very important. Do not neglect it. Start your kids on homeopathic treatment as early as possible. Coming to homeopathic treatment, we offer you two types of treatment. One is online mode and in-person mode. In online mode, you can have audio call or video call. We prefer video call for this disease. And if you have any investigations done from your end, maybe biopsy, MRI, you can share electronically. We will look into it and we will take the complete case. Based on the symptomatology, we will individualize the patient and send the medicine to your doorsteps. If you are in India, it will take 3 working days for us to send you the medicine. And if you are in US, it will take 4 working days for you to get the medicine. If it is any other country than India and US, it will take 5 working days for you to get the medicine. This is about online treatment. And coming to in-person treatment, we have a lot of branches, number of branches. You can inquire about the number of branch on +91, that is India code 7997 101 303. You can call and speak with us and inquire about the nearest branch and get the treatment done. You can reach out to us on 7997 101 303. www.fidicus.com is our website. Why you have to consider Fidicus Homeopathy for Duchenne Muscular Dystrophy? Fidicus Homeopathy has highest chance of health, and you have highest success for Duchenne Muscular Dystrophy in Fidicus Homeopathy. The treatment will be transparent. We will give the information in black and white. There is nothing to hide. The treatment you get is completely transparent, and you get personal care. So we will personally treat the patients. That's the reason you have to consider Fidicus Homeopathy for Duchenne Muscular Dystrophy. Thank you.